The main goal is that these CLTI guidelines should replace the former TASC document. So we hope that these guidelines will be used. We are sure they will, and that other version will certainly come within 3 or 4 years. But the main thing is to change in the way we think and using these guidelines to treat our CLTI patients. I think what is important is the presentation of these guidelines at as many meetings as possible. We just presented them in a full session this afternoon here at the ESVS meeting in Hamburg. So now we want to go to the various national society meeting and present them with a lot of cases, so like case-based discussion symposia where people can ask a lot of questions. Second, we just launched an app, ESVS guideline app on CLTI and also various other guidelines, and we hope that physicians will use this app at the patient bedside. The first important message is that these guidelines are global. They were developed through a joint collaboration between the SVS, the ESVS, and the World Federation of Vascular Societies. The second is that we plan to disseminate them as much as we can, as already said. Third, we go from the patient, where an evaluation of the patient risk, frailty for example, is a key consideration. Second, we look at the extent of ischemia, infection, hemodynamics, the so-called Wi-Fi classification. And third, we look at the angiogram through the glass system. So we go from patient to the angio latest and not the other way around.